When I listen to a pet's heart, I expect to hear lub-dub, lub-dub. When I hear something extra, something is off. That's a heart murmur, and that sound matters. A heart murmur is an abnormal sound we hear when listening to the heart with our stethoscope. Instead of a clean lub-dub, I hear lub-sh-dub, lub-sh-dub. The sh sound should not be there. That sound tells us blood is moving through the heart, but it's sloppy and it's messy. And then when the blood moves through the heart and it's sloppy, there is typically something wrong with the heart. Now, here's the key point. Not all heart murmurs mean heart disease, but many do. And we can't tell which is which by just listening. Now, some murmurs are harmless, and others are early warning signs of heart disease that hasn't caused symptoms just yet. And heart disease can lead to something called congestive heart failure, which is life-threatening. Our goal is simple: find problems early before they become emergencies. The first test we usually recommend are chest x-rays. X-rays let us look at the size and shape of the heart and the condition of the lungs. They help us see whether the heart is enlarged or whether there's fluid is building up in the lungs or not. Both are signs of heart failure. X-rays don't tell us everything, but they tell us if we need to act right now. Next, we often check blood pressure. Blood pressure tells us how hard the heart is working against the rest of the body. High blood pressure can worsen heart disease or even cause it. A heart that cannot handle the pressure that it's under will eventually fail. So this number matters. The next and most important test of all for heart murmurs is an echocardiogram. This is a very detailed ultrasound of the heart that shows us specifically heart structure and function, the heart wall thickness, the heart chamber size, and how the blood is moving through the heart. It gives us a ton of information. It's the only way to identify the type of heart disease if one is actually present. And this test should ideally be done by a board-certified veterinary cardiologist. Their measurements and interpretations are far more precise, and those details guide lifelong treatment decisions. I recently had a client whose cat was diagnosed with early hypertrophic cardiomyopathy, or HCM, on an echocardiogram. 6 months later, we recommended a follow-up echocardiogram. The client asked, "Why do we have to repeat this? We just did it. I just spent so much money." And I said, "Here's why. The heart is a muscle, and the muscle changes with use. If the heart works too hard, it thickens. That thickening can worsen blood flow and cause serious complications. The only way to know whether heart disease is stable or progressing is to repeat the echocardiogram. Your pet doesn't tell us if the heart is working too hard until it's failing. And you don't want to go there. You want to avoid heart failure because at that point, the heart is really struggling. What if we hear an irregular rhythm? Then we recommend an EKG. An EKG looks at the electrical activity of the heart itself. It tells us whether the heart is beating properly and in an effective way or not. Electrical problems can be just as dangerous as structural ones. The final piece of a complete heart workup is blood work. We check kidney function, electrolytes, and overall organ health inside the body. Why? Because the heart pumps blood everywhere, and treating heart disease safely means understanding the whole body, not just the heart. I know this can feel like a lot of testing, but the heart is a central organ. When it struggles, everything struggles. It also know that all of this comes with a cost. Here's the good news. When you catch heart murmurs early and you work them up, you can do so step by step and usually separate out the cost. Perhaps do x-rays first, then another time do the blood pressure, and then follow up with the echocardiogram. Ask your vet to see if you can stage diagnostics if the financial piece is a lot all at once. These steps are about doing the right things at the right time so your pet can live longer and feel better. If your veterinarian has detected a heart murmur or an irregular rhythm, do not ignore it. Act on it sooner than later. Ask questions, get clarity. Early information definitely saves lives. If you need a checklist of what to ask, check out my Substack for more details so you can be prepared for your pet's health.